Dr. Kiran KJ. I am a senior consultant in Department of Minimal Access and Bariatric Surgery, Apollo Hospitals, Bangalore Road, Bangalore. So today I am going to answer few myths about or few common queries which I get inquired from my patients. So they say a lot of vaguely when we have an interaction with anybody for that matter, they say, is hernia happening only in the abdomen? My answer is it can happen in any part of the body, since more commonly so in abdomen. Hernia is something called as a defect or a mechanical defect through which any content can pop out of your body or pop out of that particular region. So there may be a hernia between thorax and abdomen, that is called as hiatal hernia. So this is one hernia which is not visible from your naked eyes. This will be incidentally picked up when you undergo a CT scan or a endoscopy or any routine chest evaluation. Second thing is that whatever the hernias that happen in the abdomen is called as ventral hernias. And since it is very much visible to our naked eyes in day-to-day activities, we all feel that hernias are more common in abdomen or stomach. Stomach is a layman term. To be more particular or to be more precise, it is abdomen. So it can happen on the back, that is called as lumbar hernia. So hernia is not only limited to abdomen. It can happen anywhere where there is a mechanical defect. It can be between the thorax and abdomen, which is called as hiatal hernia. It can be in the back, it can be a lumbar hernia. In the abdomen, it can be a ventral hernia. In the abdomen, ventral hernia means ventral is front. So any hernias in the front of abdomen is called as ventral hernia. It includes umbilical hernia, incisional hernia developing after previous surgery, and a groin hernia, also called as inguinal hernia. And also called, sometimes we encounter called as femoral hernia, which is just below our groin, more commonly seen in females. Second, people will ask, is hernia happens only with males? That is a myth. The fact is that hernia is more common in females. Because as we age, as any human being age, the collagen content comes down, and more so in females. Hence the incidence of hernia is more common in females. And more commonly it is seen in umbilicus and in the previous surgical site. So there is a very much proven fact that hernia is more common in females than males, and the groin hernia is more common in males than females. So this is the myth which I am going to make you understand, that hernia is more common in females, not just in males. And is it easily detectable is one more commonly asked question. Answer is yes. Whenever you feel there is a swelling or abnormal popping out of any structure from your body, you should get immediately evaluated by a surgeon, not a physician. Usually more or less 80% will be hernia, others it can be any other benign swellings. So once you notice any swelling in any part of the body, you should go to meet a surgeon, not physician. So it will be easily detectable whether it is an hernia or a benign swelling. Obviously we undergo a routine scanning or a imaging, we call it, to doubly check it whether it is a hernia or a soft tissue swelling.